Acá convivimos 4 grupos étnicos, ¿verdad? Está la población maya, quechí, que es la mayoría. Está la comunidad garífuna, ¿verdad? Que vivimos en la parte central de Livingston. Está también la población ladina, ¿sí? Y la población hindú. También, así como está presente el VIH-Sida en América Latina, en todo el mundo, igual está presente en Livingston. Como población turística, como una comunidad en donde la pobreza también es factor número 1 de las migraciones. Para el 2008 ya hemos registrado una tendencia de alza.
Lincabala Inch Blanca, mi comunidad se llama Tosbial. Bueno, hay 7 familias, es una comunidad vulnerable porque vive en la orilla del río y más afectados con el VIH los jóvenes, porque los jóvenes salen de la comunidad, se van a trabajar en el pueblo. Hay veces que los padres, los hombres, vienen en el pueblo, hay padres que toman, chupan, entran en los bares, entonces tienen relaciones sexuales sin protección.
Y la condición de género también, que está mucha desigualdad social. Y todos esos factores influyen a que la mujer no tenga capacidad de negociar el uso del condón, no tenga que negociar con quién tiene que tener relaciones sexuales.
My aunt, she found out that she was HIV positive. I've seen my aunt, like, my step uncle, he's like my family now, died from HIV AIDS. So I said, no, this needs, we need to do something about it. Let the people know that this disease is very serious.
In 1990, many people were dying, but they didn't know the cause of the death. So many of them ended up thinking that they are being bewitched. Many of them ended up thinking that it is cancer.
There was like rumors all over that there is a disease that is very strange. People become thin, people diarrhea, they get cough and then they die.
The magnitude by which the impact of HIV and AIDS has taken onto communities, and particularly the grassroots women, and created an additional burden for women was unprecedented.
The health system was heavily affected. We found that in the low-level health centers, you can't get a qualified doctor. Rarely do we find qualified nurses.
Grassroots women have always taken their responsibility to see that their society have the right health, have the right food, access to water, and access to anything that they need, including energy. So HIV and AIDS actually found women in that sense already prepared to do care and support.
The international community just feels probably that grassroots women cannot do anything, and yet in reality, grassroots women are doing quite a lot more than what professionals could be doing.
Definitely we are. We are experts. Why? Because we are the people who live with these patients. We are the people who know what they want. We are the people who provide all that they require. I feel that we are experts, though the work we do is not being recognized, is not being acknowledged, is not documented. Home-based care, this is the services rendered or given to patients who are sick at home, at times who cannot access transport to hospitals or cannot get access to being taken to what? To hospitals. So what we normally do is that we extend our services to them, we care for them, we counsel them, we treat them, we sensitize them, and we improve hygiene at home.
We also realized that widows who had lost their husbands from HIV/AIDS were also being thrown out of homes because of people wanting to take away property from them with the assumption that because she's HIV/AIDS positive, she is going to die and there's no need for her to have property. So it was a big issue. It was challenging our efforts on prolonging the lives of people living with HIV/AIDS, because these women would leave the home. Maybe you have started them on a clinic, antiretroviral clinic. They go far and they abscond the clinics, or they would become even more depressed and die quickly, or they would go. Those who are still strong would go and stay in the marketplaces and get men or do commercial sex to raise their children. We grassroots women who are working as home-based caregivers identified this as a cause, in fact a very big cause that was promoting HIV/AIDS, and we did a mapping. This document was able to be shown to various institutions, development agencies, to inform them that HIV, property grabbing, was actually another cause of HIV/AIDS in various communities.
When I went for the test, I found myself positive, and I could hold it in my heart. I had to sit down and think that I'm going to die soon. I had no way to do. I looked on my children. They were very young. I went back to the doctor, to the hospital. I asked for an advice. They taught me how to live positively. I came back. I thought again, looking all around the community. Many children left, many orphans, being taken away by relatives, being mistreated. And I thought of one thing. It's time for me to find a friend of mine and walk and teach the community more about HIV and AIDS. We walked every day morning. We pack our porridge in our bags. We walked door to door. This is how the Power Positive group was formed.
Hanini modenya yone munene. 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 Okena joge mekoko mudenyo yone munene. Okena yoga koko mudenyo yone munene. Okena joge koko mudenyo yone munene. Hanini mudenyo yone munene.
Grassroots women from these four countries, Guatemala, Belize, Honduras, Kenya and Uganda, actually 5 countries, are here to share their own experiences on community responses to HIV and AIDS.
Pasa el otro mundo. Tal vez solo miramos qué es lo que pasa en nuestro mundo nosotros, nuestro alrededor, ¿verdad?